Thank you, Sean and Katerina, so much for this really, really important presentation and for joining us here today. I encourage everyone who is here with us to use the Q&A function to ask some questions. And perhaps while we wait for some questions to come in, I was really struck at the beginning by the expectations for how many responses for the survey were expected versus how many came in. And I was just curious if you had any an opportunity to expand on that. Was it word of mouth that led to the additional survey? Do you think it was just people found it so important to fill out? Or I was just curious why more perhaps came in than was expected.
Yeah, I think it was probably a combination of many factors. I think Nick was quite strategic in reaching out through many different avenues. So one was just Googling and looking up organizations, because it's not like in Canada, there's sort of a directory or something of all the organizations that work with homeless populations. We also did a lot of outreach with the support of the Canadian Alliance to End Homelessness and Tim Richter's help there. Through Away Home Canada, the Homeless Hub, through the National Learning Community on Youth Homelessness. So we kind of pulled out all the stops for all these networking and organizational sort of bodies, as well as sort of cold emails. But I mean, we all know that we've lived a last couple of years where people have been really just not responding to many requests like this, just because everyone has been experiencing so many stressors. So I think that comes to the second point, which, as you say, Stefania, is people must have had a reason for saying yes to this and wanting to share their experience and their circumstances related to their mental health in this workforce. So I think a few things. It probably was one part people wanting to advocate and contribute to advocacy and awareness raising, and then the other part is just Nick having a good strategy and working really hard with a lot of outreach.
Absolutely. And again, encourage folks to use I think we have one that has come in. Oh, Katerina, that's awesome. Yeah, so these are great points. In thinking about this conversation, what do you see changing, if anything, going forward as a direct pandemic effects lesson?
Sure. So I could start on that. And then Katerina as well, maybe from the commission and the lens there, you might have a few thoughts too. So as the pandemic winds down, I mean, I think there's some concerning things and there are some potentially positive things. So some concerning things include, there was a move during the pandemic to do things like motel and hotel based housing, and a pretty large effort to get people some more distance and safer housing, and that's winding down at the moment. I know many places are closing those facilities down and people are going back to shelters. We've seen, the response to the encampments, which has been highly problematic. And, we've seen some stuff happening around the pandemic winding down, that seem like kind of steps backwards in some ways to some things that might have been promising. But at the same time, we have things happening we still have the same government nearly exactly in place, and that government had done quite a bit of work in the area of housing and homelessness and a systemic level response in creating new units and supporting the sector. There's a lot more to be done, and I know more it's going to go beyond just creating housing units, which has been the emphasis so far. But seeing that continue and as a focus comes on that, I think in terms of the well-being in the workplace, I haven't seen much clarity yet as to what the response might be, aside from I think it's not just the homeless sector. As you look at the hospital sector and other service sectors, where you see large amounts of job vacancies and job stress, and of different sorts. The homeless sector has a unique and arguably more severe than many other places, but we have a major workforce dilemma in human services, health and human services. And I do think that will provide some impetus to governments to begin to think about, what can be done to stop the flow out and to support the people that are there. I think it's a bit TBD as to how that'll happen. And I think, in some ways, the work with the commission and with CAMH's public affairs machine is we're going to be doing our best to add these findings to the voices of others who are calling attention to stress in the field, and hopefully it will make a difference making connections with policy. But I think the Mental Health Commission is a great avenue for that, having so many existing connections. But I'll let Katarina, I don't know if you want to expand there.
Yes, definitely. I'm sorry. I'm just also paying attention to the chat, and I just see all of the really kind responses coming in. So I just wanted to thank you so much for that. And seeing that the results and the policy recommendations are resonating with people here at the conference. So that's great to see. And see how everyone can relate to this. Yeah, so I think definitely from the Mental Health Commission of Canada's side, the lessons learned and way forward is definitely to look at, I think the pandemic really shone a light on the workforce kind of behind the healthcare sector. But although that's important, it certainly left behind other parts of the healthcare workforce that are less discussed and less seen. And so really kind of shining a light on the homelessness workforce, the mental health workforce, the substance use workforce, and making sure that the capacity across those workforces and their needs are met just as much as it's important to meet the needs of the whole healthcare workforce. And yeah, taking these policy recommendations to governments and through our networks. And we also are working on a study with the University of Ottawa around the needs of the mental health and substance use workforce as well. And have ongoing projects on that regard as well. So maintaining kind of the momentum. Yeah.
That's great. I think we have time for one more question before we break for today. And this one comes from Steve. There are a lot of trainings offered for staff in this sector for a number of different aspects of their roles. Is there any information about what kinds of trainings or supports might be best to prioritize and or make more frequent to limit mental health deterioration among direct service staff?
Yeah, so a couple of thoughts. And I think really fundamentally training and mental health supports will just ultimately be only a part of the picture. I think there are some really fundamental things we've addressed here about the structure in which people work and pay and benefits and adequate staffing. I saw a comment in there that limits supports for newer staff, for example, not being as on top of what's happening with them as one might if you had adequate staffing. So I think there's a bunch of structural stuff that really needs to be a part of the discussion. I think trainings help. And trainings are important, but I think we as a field in this health and human services broadly, I think we often will gravitate to training because it's something we can do quickly, and it feels like we're doing something. So, but I guess to the point is there are trainings related to trauma-informed care and support that turn the lens back on the providers as well in terms of vicarious trauma and how that all feeds into services. So trauma-informed care trainings can often be helpful. And then, there are any number of trainings on well-being in the workplace and that kind of thing. I do think that, and the evidence backs us up on this, probably the experience of many people on this call is that one-off trainings are limited. I mean, they're better than nothing. It's not like nothing positive happens. People might get a few tips and might find some common language and have a platform in which to share experiences, which has some inherent benefit. But the kind of one and done trainings tend to not be nearly as impactful. I think where the sector, some people are heading in the sector, and it's been found to be helpful. I'm not really aware of sort of trials and things about it yet, but where you do, sure, a first one-off training, but then you build a community of practice and you have supports built in where people have regular, at different levels, ways of coming together to process critical incidents, to get support, whether one-on-one with supervisors, with peers, different ways of talking about what's happening in the workplace, having access to a psychologist, for example, at different times, whether as a team or for individual support psychotherapy. Often the EAPs and so on that people have access to are sort of short-term, sometimes not staffed by the most skilled folks. And, it's often just not enough support. So I guess if I have a running theme here is to try and have that ongoing set of supports. And this is, again, coming back to the structure. In strapped service sectors, services can't afford a psychologist on team to support the team. So it's really trying to do all one can to create these spaces in a longer term way where people can talk, get support from their peers and support from their supervisors.
Yeah, and if I just can quickly add, the Mental Health Commission has been working with CAH actually to offer our training on mental health for yourself as an employee with it across the homelessness service sector. We've traditionally offered it to employees across the mental health sector, but this year we've been working with CAH to offer it across the homelessness sector as well. So I think CAH is holding open calls for joining those trainings now. So I would look out for that, or maybe ask about that. And thank you so much for, and as Sean said, his points were great. So I think, just something, a little tidbit I just wanted to add. And thanks so much for all of your questions. I know we can't get to all of them, but I will definitely make a note of them as we go forward. And I put some questions as well in the Q&A. And there was a question about making the presentation available. I think somehow CH will do that.
I responded to that question.
Okay.
So presentations will be available on this platform for the next 3 months. And then after that on the conference.ch.ca website in our media archive. So for sure, the presentations will be accessible because they're so important. Katarina and Sean, thank you again so much for your presentation today. It was such an important one. Thank you again for everyone who's joining us in this room and for participating and for your comments and questions. I'd like to remind everyone that you are encouraged. It would be really lovely of you to complete a session evaluation. They're located under the video player in this room beside the discussion tab. It really helps us make a better conference year after year. And of course, I invite everybody to join us for the closing plenary. We will have a closing prayer by Knowledge Keeper Clayton Shirt, who joined us yesterday morning. That's in about 15 minutes at 2:45 p.m. Eastern. Thank you again.
Great. Thanks very much. Bye-bye.